Hi, this is Steve Rowe, Executive Director. Today is Wednesday, October 7th. I guess the big news since our last weekly video update that Kim Jackson did on September 30th is that President Trump tested positive for COVID. I think that was last Thursday, perhaps, and was hospitalized for a short time and then released. I don't want to be political, but I think the president did a huge disservice to all of us in especially long-term care, as we've been battling this disease and this virus for several months, and the messaging that it's not something to be overly concerned about is just so wrong, because we've seen so many people who have been affected by this and people dying, and it's baffling. So it's like it's just really hard to stomach some of the things that we see and hear, and yet we just keep going day to day and do the best that we can to keep everybody safe and healthy, and the community thriving to the extent that we can. So enough about that, but I felt like I needed to address it in some way. Yesterday, when Kim Jackson did our family update to health center and assisted living family members, we also presented a new grid, new guidelines for visitor access, group sizes, different things like that. That was distributed to all of our resident mailboxes yesterday afternoon. And a couple of changes there that I just want to make sure that you're aware of. The number of, first of all, visitor access. Early on in the pandemic, CMS, which is the governing body over nursing homes in the United States, basically restricted visitor access entirely. We essentially shut down nursing homes to visitors, and we lived with that for many months. And now the guidance has done a complete 180-degree turn, and regardless basically of what's happening around us, we need to allow visitors in. So that has a ripple effect, and the guidelines that Department of Public Health put out originally were about 26 pages long. Most recently it's down to 4 pages, and now instead of a phased approach of phase 1, phase 2, and phase 3 being the least restricted, what they're looking at is the positivity rate within your area. And our area most recently has been about a 5% positive rate. So 1 out of every 20 people tested is testing positive. At that level, we're allowed now to start bringing in the outside people who, like the banks and podiatry and different services like that. We have chosen to continue to allow visitors to independent living still just at 2 at a time and only in apartments. So still not into the common areas of our building, but if the trend in Johnson County continues, that'll be the next step, is that we open up a little bit more for visitor access. Probably the biggest thing that impacts some of you, if you're participating in group activities at all, exercise classes or things like that, we will be increasing the size of the groups from 15 to 20 people, essentially effective immediately or as soon as that can be managed. So Laura's exercise group will now have 20 people in it, if we can do it in a way that still allows for social distancing. So the studio, we may not be able to have a full 20 people in. Hide Room B, we can certainly spread out and get 20 people in there and still be socially distanced. So be looking for that, and that's probably the most significant change that's happening right now. Cases in Johnson County have been trending downward, which is good for all of us. Most recently, it's like down in the single digits for some days. The last time I updated the tracking sheet that we've been using was 2 days ago, and the average 14-day daily average case count was had plateaued right around 20 new cases per day, which is down very significantly from where it had been. But it's like if early in the pandemic we had heard 20 new cases per day, we would have been quite anxious about that. So everything is relative. It's down. It's still higher than we would like it to be, but we're doing much better in Johnson County in managing new cases. That it can't be said across the state of Iowa. I heard on the radio this morning that we actually had a record high number of new cases yesterday across the state, and hospitalizations are up to near record levels as well. I think there were 90 some new hospitalizations that occurred yesterday. It seems like many of those are happening in western Iowa. We don't have the same level of activity here in eastern Iowa right now, but it's just something to be aware of and continue to be cautious, be vigilant, and be optimistic. We will get through this. We're headed in the right direction in this area, and it's exciting that we can start to do some new things in the Oaknoll community. We're looking at, if the trend continues, we're looking at hopefully being able to invite a lecturer or a musician, somebody who's not singing, but somebody to actually do a program and have a small number of people in a live audience if people are interested in that. And from a technology standpoint, I think we're pretty close to being able to just live stream that program to resident apartments. So that'll be the next thing as we get people that are comfortable coming into a community like Oaknoll to share their skills, their talents, their expertise, that we can start to do some different things with programming. So I'm looking forward to that over the next month or so, trying to figure out how we can make that happen for you. Again, if you have any questions, please feel free, ask them so that we can address them in these weekly video updates. Thanks. Have a great week.